trying to talk about assessment of intracellular enzymes. Assessment of intracellular enzymes. Right. So for the assessment of intracellular enzymes, you're just trying to look at it's actually like a critical what? It's a critical aspect of trying to diagnose any disease. You get. So intracellular enzymes, probably their levels will be distorted usually when there's a problem. You understand? So that they actually play the enzymes actually play key roles in cellular metabolism, and they can indicate if there's tissue damage or there's tissue disease. You get? So when you now find that there's abnormal levels of these things in the blood and all of that. So intracellular enzymes such as what? Alanine aminotransferase, lactate dehydrogenase, and aspartate aminotransferase. All of these are typically confined within cells. So if you now see them in blood so much, you know that there's cell damage. So the cell was damaged. That's where they actually escaped from the prison. Okay. So it can now be used in diagnosing diseases. All right. So different tests which could do is liver function tests, cardiac markers, all those creatine kinase, all right, lactate dehydrogenase. Then muscle markers, also creatine kinase, that indicate that there's muscle damage or muscular dystrophy. So mechanism of release is they are usually released in the bloodstream when there's cell damage, or there's necrosis of the cell, or there's increased turnover of the cell. Alright. So enzymatic measurement is usually measured using biochemical assays. Alright, using biochemical assays. Then clinical importance is they can be used in diagnosing various diseases that have to do with cell damage. Alright, so liver disorders, cardiac conditions, muscle injuries. You can actually use all this assessment of intracellular enzymes to diagnose them.